Welcome back to Wellness with Delaney. I am so excited for today because I have been getting so many people requesting this specific topic, probably more than any other topic, and that is fertility. In 2025, we are seeing shocking rates of infertility struggles, PCOS, or just having a hard time getting pregnant and not knowing what to do, having a hard time maintaining pregnancies, not knowing what to do. So I have Dr. Natalie Underberg on today. She is an amazing functional doctor. She actually is a chiropractor who has worked with hundreds of women to help them overcome infertility struggles. Her husband has worked with men to help them overcome infertility struggles. So we have really all of the different angles. So for those of you who are thinking about conceiving someday, actively try and conceive, or even if you are pregnant, which would be amazing, this episode is for you. You are going to learn so much. I am so excited to deep dive into this topic. Dr. Natalie, thank you so much for joining.
Yay, thank you. I'm so excited to be here. I love talking about this. So it's my favorite thing. Let's just dive in.
I love that. So can you tell me a little bit of background how you went
hmm
from being a chiropractor to
hmm
focusing primarily on fertility?
Yeah, great question. So very early on in school, I should say even into my early undergrad, I knew that I did not want to practice conventional medicine or Western medicine in the conventional sense. And I kind of looked at all the programs and kind of what was out there and things like that. And I very much chose, everyone thinks I like fell into my degree on accident. I'm like, no. I very much chose the chiropractic route on purpose because I fully intended on practicing functional medicine all along. So I've actually never practiced chiropractic. It's like the funny thing. I'm like, I'm a chiropractor that's never practiced chiropractic. I obviously can
Amazing.
adjust and things like that. It's in my toolbox, but I don't, and I haven't since basically when I graduated. I just really realized I loved the principles of chiropractic and the education behind it. Like our education is so in depth. The anatomy and physiology, the neurology that we learn, um, the physiology in general was so in depth. And so that really, for me, is why I picked that route because I loved how I was going to get a deeper understanding of the body, a true education on just how the body works from an unbiased perspective. Because in chiropractic school, like we don't have pharmaceutical companies sponsoring our schools, right? So we're just getting a very clean, cut and dry, unbiased education on the human body. And it's very in depth. And so that led me to kind of creating a really strong foundation for functional medicine. And what I did while I was in school was I simultaneously was in functional medicine programs while I was in chiropractic school. So I would be traveling all over the country on the weekends, going to seminars, getting my credits for functional medicine, completing coursework for that. So it was like kind of like I was in two grad programs at the same time, essentially. But that is kind of the route I wanted to take because I grew up seeing a holistic doctor my entire life. He was the only one that ever gave me answers. I'd gone the conventional route for myself, for my own health issues. It never really did anything for me. I never got answers. If anything, I was more confused than ever leaving. But my holistic doctor growing up actually went to my alma mater. He was one of the biochem tutors at the school years before I even went there. And his passion for holistic medicine is really kind of what made me interested in it as well, too, along with my own journey. So kind of a long roundabout answer, but yeah, that's why.
That's amazing. I love it. And I love that you're so passionate about this topic. I think
hmm
nowadays it's even more important than ever. And,
hmm
I don't know about you, but I've been pretty shocked lately hearing how many healthy women are
Yes.
sharing their fertility struggles from big health influencers to girls in my DMs that I just know in
hmm
day to day. And it seems like
Yeah.
it's people who are eating healthy, working
Yeah.
out, like you would think they would have no issue getting pregnant,
hmm
and yet they're years into trying and still nothing. And then they go to the
hmm
doctor and they're told they have unexplained fertility. Like what
hmm
what is this diagnosis?
Yeah, absolutely. Well, first of all, I want to piggyback on your last question because I didn't answer it. And then I want to circle back to this because it's tied together. I actually intentionally never planned on working with infertility patients to begin with, but it was this exact question that you're asking about
Mm.
that led me down the rabbit hole of this because I was having women come into me for various things, and then we were accidentally getting them pregnant with my
Wow.
protocols, just working on their bodies from a foundational approach. And then I figured out, I'm like, okay, wow, this really works for fertility too. I'm going to do this again and again and again and again. And then it worked. And then during COVID, I started having all these women come into me with unexplained infertility diagnoses. And I was like, okay, this is weird. Let's peel the layers of this and figure out where this is coming from. And like you mentioned, unexplained infertility is a diagnosis these women are getting, but unexplained infertility literally does not exist.
Wow.
It's the definition is a modern medicine definition for we don't really know what's going on. We don't really know why you're not getting pregnant. And I have never found a case, basically ever, where it was truly unexplained. They came in to me and they were saying, this is the diagnosis I've been given. And then after a series of tests, I have figured out the answers to why they couldn't get pregnant. So it's not truly unexplained, it's just undiscovered. And that
Mm.
should be the title of it, is undiscovered infertility, because people just are not getting the workup they deserve, because the profit does not lie in figuring out the root cause of why someone can't get pregnant. The fertility industry is $1 billion industry, and they want to send women down that route because it is so profitable. The profit is absolutely not in me running a few tests that my patient pays what I pay for. I don't mark up anything. I'm just giving them access to testing. They're getting the testing. I'm finding them answers, and then they're getting pregnant naturally. And
Wow.
so that to me is like the most powerful thing, because I have no incentive for these patients to not get pregnant. I have every incentive for them to get pregnant, and I don't make more money either way if they do or they don't. I'm just here along the way to kind of guide them. So a big thing I was seeing with these unexplained infertility cases was there was a lot of male factor stuff. And if you go into a conventional fertility clinic, what they're going to do on the man is run a basic semen analysis, and that's basically it. They're going to send them on their way. I have never once talked to a couple where the male actually was given a formal, in-depth investigation. It's always, oh, your semen analysis looks okay by their standards, right? Which, if you compare semen analysis now to what we would even 20 or 30 years ago, the standards have absolutely been lowered. The bar is so much lower now for the quality of sperm that they're even looking for. So they're accepting, let's say, 4% morphology or 4% motility being okay. That means only 4% of your sperm are moving the way that they should. That is not normal. Why are we accepting this as normal? And so it's just a very weird phenomenon that we're in, that people being, unhealthy or being infertile, in air quotes, right, is now this accepted thing, and that we should just drug them up and medicate them and force their body into submission and force them into getting pregnant when their body's clearly giving us a warning sign. Like, infertility, in my opinion, is just a symptom of a deeper rooted issue. It's just a warning sign of something else going on in the body that we need to investigate. And that should be a clue to practitioners or specialists or providers of any kind. If someone cannot get pregnant, you need to look into the deeper reason why and figure that out. You don't just need to throw Clomid at them or throw Letrozole at them or throw a medicated cycle at them and say, let's hope for the best, because that's the definition of insanity, right? Especially if it's not working over and over and over again. So that's my frustration with that whole process, and kind of like where it started.
Yeah, it's extremely frustrating. And, there's so many reasons why I personally am not a fan of IVF.
Mm-hmm.
One is I do feel like it can have a very
Mm-hmm.
predatory approach towards women.
Yeah.
I've heard stories of girls coming in and they only test estrogen and progesterone. They're like,
Yep.
okay, here, we want $30,000. Let's do this. Instead
Yep.
of looking at everything else, like
Mm-hmm.
no C-reactive protein testing, no leptin testing, none of
Mm-hmm.
these things, right? No
Yeah.
thyroid testing. And I'm like, what on earth? Why would anyone in the right mind want to go that route before even
Mm-hmm.
looking? So when you're
Right.
looking, male or female, when
Mm-hmm.
you're looking at those deeper root causes, what
Mm-hmm.
are like the lab work biomarkers that you're going to be
Mm-hmm.
most closely looking towards when it comes to fertility?
Yeah, for fertility, one of the things I look for first and foremost, like when I'm perusing through someone's labs, I go straight to their iron panel, iron and
Mm,
ferritin first and foremost. If ferritin is low, if ferritin is below 20, pregnancy is going to be nearly impossible. I've just seen that across the board. The second I get ferritin above 20, which is still suboptimal, someone usually will get pregnant really quickly.
wow.
But ferritin is the storage form of iron. If we don't have enough ferritin or enough iron circulating in the blood, we cannot get enough oxygen to our tissues. So our body perceives that it is an unfit environment for a baby or for a pregnancy. It's a complete protective mechanism. It's the body doing something for you, not to you. I always tell people that I'm like, your body is protecting you, because if your ferritin is in the tank in pregnancy, and I've seen this with several people, you're going to be out of breath. You're going to be winded. You're going to be beyond tired. You're going to be fatigued all the time. You're not going to have enough energy into your cells. And women just feel pretty lethargic in pregnancy with really, really low iron levels. And it can also be detrimental to your baby. So the body's absolutely protecting you in that sense. So I always look at that. Another thing I'm looking for is a comprehensive hormone panel, to include precursor hormones like pregnenolone, which is the upstream hormone to DHEA, progesterone, estrogen, all the things. No fertility. I've never once in my career seen a fertility clinic or fertility specialist test this hormone ever. I don't even think they know what it is. I've had specialists DM me and say, wait, like genuinely, will you explain to me why you order this? I've never heard of it. I was never taught about this hormone in
Wow.
school. They do not know what it is.
This is
Now
crazy.
yes, they could Google it and they could figure that out, but they're like, I want to know like why you're testing it and like what you look for. I've had really interesting conversations with even functional medicine providers as of just recently who were like, wait, tell me more about this. Like, why are you checking this hormone? My inner circle of colleagues and friends that know me, they're all testing it because they've heard my rants. And so that's great for their patients, but I'm almost always seeing pregnenolone being really, really low because of longstanding periods of stress, malnutrition, whatever it may be. And if you don't have enough of the ingredients to make your downstream hormones, then fertility is going to be really impossible. Pregnancy is going to be really impossible. So anytime I see a low pregnenolone level, I also start to think, okay, well, A, why is this happening and how can we start to support it? So that's really important to me too. And then obviously things like insulin and leptin and things like that too. If you are just extremely insulin resistant, it's going to be perpetuating inflammation, which all of that makes it really hard to conceive. It makes ovulation much harder, makes cycles much longer, sometimes can make periods more painful. And overall, insulin resistance is driven for the most part by inflammation and vice versa. So you're kind of in this inflammatory hamster wheel or inflammatory cascade. And when that's happening, it's very, very hard to get pregnant, maintain a healthy pregnancy, and not have early losses and things like that too, which is why I think that there's this huge stigma around PCOS and infertility. And it's not that having PCOS just makes you generally infertile. That is not what it is. It's that when you have really high levels of insulin, it makes it very hard to ovulate properly. And your ovaries start to make higher amounts of hormones like testosterone. And so that's really the reason. It's not just that PCOS equals infertility, which I actually hate that. I hate that it's associated so heavily with infertility because it's not true. And women with PCOS get pregnant every single day, have great, amazing, healthy pregnancies, but you have to address that underlying inflammatory and insulin resistance component. So that's a really big piece of it.
I'm so glad you brought this up because I have a million questions about PCOS,
Yeah.
mainly
Yeah.
because, and maybe you can answer this a little bit, but like I
Mhm.
am seeing more people than ever with PCOS.
Yeah.
Is this is this because we're more aware of it, or are we actually seeing skyrocketing rates of PCOS?
I think both. I think the prevalence of PCOS is higher than it was 20 years ago, even 15 years ago. When I first started my career, it was 1 in 10 women that had PCOS. And then it was 1 in 7 women that had PCOS. And now I've seen people even saying it's 1 in 5 women that have PCOS.
Wow.
So it's more and more prevalent than ever, more and more common than ever. I do think the awareness around PCOS is a big piece of that puzzle, but also our environment is so much more toxic now than it was 15 or 20 years ago. Everything is more inflammatory. Everything is more toxic. And I know people are like have an aversion to that word, but it's true. I don't know how else to say it, is that the chemicals in our food supply, in our environment, in our beauty products, they're getting more and more sneaky with what they're calling things. They can sneak things in a formula and put the word fragrance on it or natural flavors or whatever it may be. And people are getting exposed to more chemicals than ever in our lifetime, which is why we're also seeing sperm counts declining at the most severe rate in human history, really in the last 50 years. We're seeing male fertility more than ever. We're seeing female fertility more than ever. There's a reason for it. And same with PCOS. I mean, if you look across the board, humans in general are sicker than ever. We're having these turbo cancers that are popping up out of nowhere, and people are going from stage 1 to stage 4 overnight. That's not normal. That didn't happen 20 years ago, even 10, in my opinion. And so I do think, back to PCOS, I do think it's more prevalent now because of awareness. A lot more people with social media and things like that are able to go in and talk to their doctor. Like, they might see a post of mine, what is PCOS? And they're like, hey, that sounds like me. They go to their doctor, they get a diagnosis. PCOS in some cases, though, is also being overdiagnosed. So
Oh,
a
wow.
lot of times lazy providers are just giving women a diagnosis of PCOS to shut them up, is what I've seen. So I'll have a woman come into me and say, oh, I went into my doctor, told them a few things. They told me it's just PCOS and to go home and take metformin and birth control. And I'm like, well, what tests did they run to determine this? well, nothing. I just told them I was having a hard time losing weight, blah, blah. And I'm like, that is not a diagnostic criteria of PCOS. So they're being lazy and they're slapping you on with a diagnosis that's sending you down a spiral. And it's not even true.
Mhm.
So that's a big thing too, is that it's being overdiagnosed, but it is more prevalent than ever as well too at the same time.
Yeah, for sure. And yeah, PCOS is it's a tough one for sure. Like I've had
Mhm.
girls tell me, because I'm big on the like, let's get off birth control. I've been
Same.
really loud about that, which I love that you're about that, which is one of the reasons
Mhm.
why I was so excited to interview
Yeah.
you. And I was talking to a woman who has PCOS about it, and I was like, hey, like
Mhm.
maybe you should get off the patch. And she was like, "No,
Yes.
I have PCOS. I can't go off of birth control ever." And I'm like, "This is
Yep.
not good." Like, these
Yeah.
are the girls I'm like, I want to reach, because I'm like, this is women are not being given the right information about where
Mhm.
their condition comes from, what to do about it. Doctors are slapping lazy band-aids on it, and it breaks my
Mhm.
heart. So one thing I've heard is, and this is where I'm like, okay, you can myth bust with me a little bit.
Yeah, I love
I've
that.
heard that PCOS is really like diabetes of the ovaries. Is that true?
Mhm. In about 70% of the cases, it can be. Yeah. Like, so 70% of PCOS cases are insulin resistance driven or elevated. What those women suffer with elevated blood sugar levels, elevated A1C, things like that. That is very common. The other 30%, though, are lumped into that category and they absolutely do not have that problem. But
Mhm.
I think diabetes of the ovaries is a somewhat accurate description. Um, so, yeah, I would say I agree with that actually.
Oh, okay. This is really good to know, because I've always
Yeah.
wondered if that's true. I like heard it
Yeah.
once in a podcast. It stuck in
Yeah.
my brain, and I was like, I
Yeah.
can't start saying this, you know? Got to
Yeah.
fact check myself.
Yeah.
But so then with these women, with the ones specifically that do struggle with the
Mhm.
elevated blood sugar, with insulin levels, and that's kind
Mhm.
of the cause or the correlation
Mhm.
in their PCOS, what would some of the lifestyle factors be to help them be able to maintain a pregnancy or get pregnant in the first place while they have
Mhm.
PCOS?
100%. Okay, so this is something I want to drive home for people. So I get questions in my DMs all the time, like, what biohacks can I do? What fancy protocols can I do? Here, whatever. The most important thing that you can do is dial in the foundations. And the biggest thing that is left out with my PCOS clients in general is resistance training. And that is the number one thing they need to be doing. So if you can build muscle and resistance train at least 3 to 5 days a week, it's going to make your PCOS significantly easier to manage. If you can take short 5 to 10 minute walks after your meals and get your blood sugar down after a meal and kind of mitigate that spike, that post meal spike, that will help a ton. If you can focus and target in on sleep and rest, that is huge too. Um, I find that a lot of PCOS women are so fatigued. It's probably the number one complaint I hear with PCOS is I'm just chronically fatigued, which gosh, I have so much sympathy for that because I have lived that myself. I have been there. You feel like you literally cannot like put one foot in front of the other some days. Kind of in the midst of my own PCOS journey, probably 10 years ago, I was basically bedridden from fatigue because if your blood sugar is through the roof, you're going to be sleepy. You're going to be tired, especially if you don't move after a meal and get that glucose out of the bloodstream into your cells or into your large muscles, right? And so that is what holds a lot of women back. And so the first like 30 days or so, you have to push through the fatigue. But this is also where I bring in high quality supplements like my multivitamin, glucose support, berberine, omegas to get down the inflammation, things like that. You have to lean on those tools while you're in kind of that initial stage of getting through it because you can't just over caffeinate yourself, which is what a lot of people are doing. They're over caffeinating, they're overstimulating, and then they have this fight with cortisol. And so they have chronically high cortisol because they're tired and now they're overstimulating themselves and running on coffee. And it's just this really vicious cycle, which I was in my early 20s. I remember this. I was like, okay, well, I'm tired, so I need coffee. Now I feel stressed because my cortisol is through the roof, but now I'm crashing at 3 p.m. Oh, and then I'm going to re-stimulate myself to get through the night and study or whatever I had to do, go to work. And then I can't sleep at night. So I'm tired the next day. And it's like this vicious cycle. So if I could encourage anyone listening to this, it's really do not underestimate the lifestyle foundations and how much quality sleep, movement after meals, resistance training, eating a high protein diet, being aware of carbs and sugar in your diet, how much that can really make an impact for you. And you don't need all these fancy biohacks. You don't need all these fancy tools. Yes, quality supplements absolutely are non-negotiable in my opinion for most cases because insulin resistance is really hard to combat without the herbals and things like that. Um, but you can really do so much with lifestyle for PCOS, which is really cool. And something I was thinking about on the way here too is I know I get a lot of questions every day. What are your thoughts on GLP-1s and all the things with that for PCOS? I am not anti GLP-1, but I am anti GLP-1 if the foundations are not in place. If you haven't mastered the lifestyle piece, if you're not resistance training, if you're not sleeping well, if your diet is not on point, I do not think that GLP-1s have a place. I think if you're doing all of that and you cannot move the needle, a low dose GLP-1 maybe is something to talk to your provider about, maybe. But what I see happening is that is now step 1 instead of step 10, and that is a problem for me. That should never be someone's step 1. If you aren't building muscle, you're not moving after meals, and you don't have the foundations in place. So it seems like that would be the solution for people. And I see a lot of providers even taking that route. But to me, that should be step 10. And we shouldn't even need to get to step 10, ideally.
Yeah, to me, it seems like lazy prescribing because there's also the
Mhm.
component like women need that protective skeletal muscle. And if they're
Yep.
not eating enough protein, resistance training, and then they go on a GLP-1, they
Yep.
waste away. And I'm like, that I feel
Mhm.
like is eventually going to have a
Yeah.
negative effect as well.
Yeah, 100%. Yeah, there's going to be pros and cons with everything. For me, the side effect profile has never been worth it. Like, I just didn't want to risk any of that. And same with my patients. Maybe for one or two of them, I'm thinking, okay, the risk or the benefit outweighs the risk. But for most people, it doesn't. And for most people with PCOS, for most women with PCOS, if you are doing the resistance training piece consistently, then you won't need that typically. So, that if you want to avoid the resistance training piece, you might need that. But if you're
Yeah.
consistently resistance training, you won't.
Yeah, absolutely. That's so important. Like so many people I don't even think realize that GLP-1 is a hormone that we can
Mm-hmm.
produce naturally,
Mm-hmm.
and there's so much we can do to naturally support that. I
Mm-hmm.
take I don't know if you've heard of it, it's called Metabolism Ignite, and it's just plant
Oh,
polyphenols. It's lemon
okay.
verbena
Yeah.
and hibiscus, and
Love
they
that.
did all these clinical trials on it, and it's proven to increase GLP-1 by I think 60% just
Great.
naturally. But it's
Yeah.
it's plant polyphenols. So it's
Mm-hmm.
totally, I mean, it's safe for pregnancy, it's safe for all these
Yeah.
things. And the founder actually created it because she has Hashimoto's.
Love
And
that.
yeah, so for me, I'm like, why would I ever go the route
Mm-hmm.
that's going to force my body into this state when
Mm-hmm.
there's so much we can naturally do to support our hormones and
Mm-hmm.
increase GLP-1 production in a safe, natural way?
Right. And my hesitancy with this too, and a lot of people use the term food noise, right? The GLP-1's quiet food noise. Okay, well, if I look across my patient base, most of the time, my women are undereaters across the board. And
Mhm.
I talk to my practitioner friends about this too. One of my friends, she's so passionate about this. She's like, everyone is walking around starving. Like, no one is nourishing.
Wow.
Everyone is undernourished that we see. I literally just talked to a patient yesterday. They've been trying to get pregnant for 5 years. They've been everywhere. They did medicated cycles. They went down the fertility route, all the things. My very first visit with her, I was like, I'm going to tell you this because in the most loving way I can, because I love you as a human. Your body is starving. You have no iron. You're under eating. And this is the reason why you're not getting pregnant. And she looked at me and she's like, really? I was like, you're not getting any protein in your diet. You have no iron. You're not consuming enough red meat. And she's like, oh my gosh, she got pregnant 60 days later. 60
Amazing.
days later. And she was like, my husband and I are both in shock. And she's like, I cannot believe that the fertility clinic never told me you're not eating enough protein. And I was like, thank God I didn't send her down some rabbit hole of GLP-1s and fertility medications and stims and all this stuff, Clomid that she already did. I'm like, let's just take it back a notch and see what you're actually putting in your mouth every day because it's likely not enough. And I can see that in labs. I can see if someone's super undernourished when I'm looking at their cholesterol levels, when I'm looking at their um, insulin levels, when I'm looking at ferritin and iron and things like that. I can just tell when a woman's undernourished. And then also in the symptoms that they report. If you're sleeping all night long and you're waking up tired constantly, you might not be getting enough fuel in your body. You could also have sleep apnea too, which in this case I had her rule out. I had her do a sleep study to be sure. But I'm like, it could be chronic sleep apnea or it could be that you're chronically under eating. And it was just as simple as her eating more red meat, eating more protein, being conscious about her food throughout the day that got her pregnant, which is absolutely insane. So that's my whole that's my whole issue with the whole, let's get on a GLP-1 to quiet food noise, because most of these women are already under eating and they just need to be moving more, lifting heavier, building muscle, and eating more protein.
Dr. Natalie, let me tell you, that would never be me. I get made fun of for my egg and meat consumption. You should see the
Yeah.
way my family just like when I
Yeah.
go home for the holidays, my parents are like, I guess we need to have like 18 eggs a day in the house because Lainey's gonna have her 5 egg omelet every morning.
Yeah.
It's
That's so
absurd.
funny.
But I'm like, I don't know how people I've had
Yeah.
girls be like, hey, can you help me lose weight and get fit? I'm like, okay, what are you
Yeah.
eating for breakfast? They're like, okay, I'm having a high protein breakfast,
Yeah.
2 scrambled eggs. And I'm like,
Same.
so you're
Yep.
having 120 calories or 140 calorie breakfast. Okay.
Right. Right.
All
12
right.
whole grams of protein there.
I'm like
Yeah.
that we are not even halfway to muscle
Yeah.
protein synthesis,
Yeah.
sister. And when I'm like, you need to, can we triple that? They're like, what?
Yeah.
Like,
Yeah.
yeah, it's absurd.
Well, 100%. And the amount of women who've told me that just eating a higher protein breakfast and a higher protein lunch, they're like, oh, I'm not crashing anymore in the afternoon. I'm sleeping better. Like their symptom checklist that they come in with is cut in half. Like
Mhm.
by visit 3, they're like, oh, yeah, I don't have that anymore. Oh, yeah, I don't have that anymore. And I'm like, all we did was have you eat more, which is crazy.
Yeah.
And they're like, this was easy, right? And I am like, there's zero judgment because I have been that person. One of my good friends, Josh Kreifels, you can follow them online on Instagram at the Kreifels. Love them. They're all about animal-based eating, movement, lifestyle, all the things. He has taught me to, in the last few years, I've like worked with him one-on-one, and he had me do a food log a few years ago. And I was like, oh my God, Josh, I am under eating. Like I am chronically under eating. And he's like, you are. He's like, we got to work on this. And so even as a provider myself, I wasn't even realized that I was doing that. And so I have to consciously on a daily basis think about how much protein I've eaten. Have I eaten enough lunch? I'll miss a meal because I'm so focused on my patient load or what I'm doing. And I'm one of those like high achievers. And so I can kind of like trick my brain into thinking I'm not hungry. I'll skip meals, things like that. So I have to be consciously aware of that. But a non-negotiable for me is breakfast. I wake up starving. I'm ready to eat and I want protein in the morning. I crave protein. I probably eat a steak for breakfast 3 or 4 days a week because that's
Love this.
literally how I feel my best. So yeah, that I prescribe steak for breakfast to a lot of my patients. I'm like, we're gonna start having a steak for breakfast and see how you feel, or a bowl of ground beef with eggs and avocado and veggies, whatever you like, and just load up on protein. And it's crazy how it changes their whole life.
Oh, yeah, and I mean, even from the blood sugar standpoint, starting with
Yes.
something that's so, like, stable for your insulin, oh
Mm-hmm.
my gosh,
Yeah,
it changes the game for energy levels. So,
it
are you
does.
seeing then for women who are more on the plant-based or, like, on the
Mm-hmm.
plant-based end of the spectrum, do they have a harder time getting pregnant than the
Oh,
animal-based?
100%.
Ooh, okay.
100%. I have talked about this on countless podcasts and interviews I've done. My vegan patients are my toughest cases across the board. Now, I've only had a few because there's a lot of people, I tell them very transparently, I don't think I'm going to be able to help you if you can't bring in animal protein. And I know there's been several people that even like we're working with a vegan nutritionist and all this stuff, and they were hitting their protein goals. The plant sources of protein are not the same as the animal sources of protein as far as nutrient profile, and you just can't get what you need. They've even compared vegan placentas to animal-based placentas, and the placentas of an animal-based eater are significantly healthier and more
Wow.
vibrant, and they have a better blood flow. And so that is the craziest thing when you compare that. But no, absolutely. I will tell people I do not think I'm going to be able to help you if you are eating a plant-based diet. It will be very, very difficult for me. And I tell them that right up front. Um, and so, yeah, that I know people who've actually, I have one friend right now. I've talked to people who've had a vegan pregnancy versus an animal-based pregnancy, meaning their first child, they were vegan during that. And they will tell me the comparison of their pregnancy experience and how much better their pregnancy was and how much more energy they had in their second or third pregnancy eating animal protein versus a plant-based diet, and how much healthier their babies are. If you look at these, I mean, I love studying the health of my patients' children. I'm always asking them, how's your baby? Send me pictures, all the things. These moms who are working with us, who are eating tons of animal protein in pregnancy, who are doing all the things we talk about, managing the foundations, their babies come out with these full heads of hair. Like
Wow.
if I could show you the hair of all of my patients' babies, just go on our website and look at all of them. They come out with these thick heads of hair, from all the choline in my prenatal, all the animal protein that they're eating, the eggs, everything across the board. they are the healthiest babies. They're like baby geniuses. And it's because they're getting all the amino acids and the protein and the omegas that they need to fuel their little brains. And it's so cool to see. So I love watching, like, I would love to do a study on this, but I love watching my patients' babies grow up and see how healthy they are.
I love this
Mm-hmm.
so much. That's so
Yeah.
interesting, and obviously, as an animal-based creator, it makes me feel really happy to hear
Yeah.
that.
Yeah.
I'm especially as one who used to be vegan because I've seen
I
my
didn't know
health.
that.
Oh, yeah, I was vegan for 5
Okay.
years. That's a huge reason why
No
I'm doing what
way.
I'm doing now, because I was sicker than a dog for those
No
5 years.
way. Oh my gosh. Okay. Do you mind sharing a little bit with me about that
Yeah.
experience?
Of course. Yeah.
Okay.
I went vegan originally in college. So
Okay.
2018,
Okay.
I wanted to lose weight,
Mm-hmm.
which a lot of the weight gain was from birth control.
Yep.
And so I got put on birth control because I was feeling some acne and bad periods. My
Mm-hmm.
doctor was like, I'm not going to ask what you're eating. I'm not going to ask about your
Yeah.
drinking and partying. I'm just going to put you on the pill.
Mm-hmm.
And then I gained a ton of weight. And then I joined a vegan startup and was told it'd be a great way to lose weight. So I did it, lost a
Okay.
ton of weight. At first looked great. So, I think at first I was like, this is awesome. And then all of a sudden I was like, why do I have no energy? Why am I so drained?
Yeah.
Why am I getting hormonal acne? All these things. So I got blood work. I think at this point I was 21 years old, like newly
Okay.
21. And my naturopath, who is still my naturopath, discovered
Mm-hmm.
that my thyroid was rapidly declining.
Okay.
And so then I get put on Synthroid because I was vegan. So I didn't want to do any of the animal based
Mm-hmm.
natural thyroid.
Mm-hmm.
And then eventually, when I was engaged, not that long later, I got engaged at 22. I decided to get an IUD to prep for marriage. And then the combination, my body went crazy. So between the veganism and the IUD, I got
Oh,
severe hormonal acne. My thyroid continued to tank, and I was just a mess. So I slowly, over several years, got rid of the IUD. One day woke up craving salmon like I've never craved anything before.
oh
Turns out
my
my
God.
selenium was non-existent, so that made sense.
Yep.
And then started eating seafood, moved on to adding
Mm-hmm.
eggs, dairy,
Mm-hmm.
meat, just slowly over a couple of years, because I
Mm-hmm.
realized that anytime I would start to crave something, I was like, I'm just gonna listen to my body, see what happens,
Yep.
and then ended up becoming animal based because I no longer
Wow.
can tolerate a lot of those heavy like kale bowls and beans and all these things. I gave those up.
Mm-hmm.
And now I eat a little bit of plants, but I'm eating mostly animal based. And I
Mm-hmm.
got lab work back on Monday, actually.
Yeah.
And my numbers, my thyroid, I'm not on any medication anymore. So
Wow.
I've been doing beef, liver, and thyroid for over a year
Mm-hmm.
now, maybe a year and a half, as well as lots of other organs. And
Mm-hmm.
I'm taking fish eggs and metabolism ignite, all these natural supplements. Thyroid is in the normal range. My progesterone at the lowest was 0.2 during my luteal phase, and now it's in the normal range. And so I've been able to, all these things that I was told I was told that I would always struggle with progesterone, probably have to do HRT someday,
Mm-hmm.
never be able to get off of thyroid medication because it was always going down. I was able
Mm-hmm.
to get all of those things into the normal range with
Wow.
lifestyle. So it's been amazing.
That's so consistent with the stories I've heard in the past. I love hearing these stories because I will say a lot of people who go plant-based feel really good at first. The same way you feel really good when you do like a 2-day fast because you're
Hmm.
living on cortisol. I'm convinced. A lot of people say they feel really light, they feel good, they can lose weight, but also you're kind of in a state of starvation. So, I mean, there's a lot of cancer clinics that have cancer patients do like a raw vegan diet for a period of time. It's literally starving out cancer cells. But if you think of this, it's starving out all your cells. That's why
Yeah.
it's working. It's starving your body, basically. So if you can starve out a cancer cell with it, you can starve out a regular cell too, healthy cell, I should say. And so I think there's a time and a place for it. I've seen people do it just to reset their gut for a few days. I've seen people do it who maybe can't eat animal protein for a specific health reason, which is really rare. But it's never a good long-term solution from what I've seen. And the whole blood type diet thing, that's not proven with any sort of science. And a lot of people will say, oh, well, based on my blood type, I do really well with this. And I'm like, yeah, that's not really substantiated, but it's really cool. It's really cool to hear these stories because I do see that as well in my patients.
Yeah, it's been an amazing journey, and that's really a huge reason how I got into this podcast that we're on
Yeah.
today, is realizing that so many people don't have good information,
Yeah.
and I want my healing journey. I always like to think anything bad I go through in my health
Yep.
is material for me to help other people who are going through that once I get on the other side, right? And so
Yep.
that's what really inspired this. So then with all of that, with thyroid, because
Mm-hmm.
obviously, I do hear of some connections between maybe thyroid or
Mm-hmm.
Hashimoto's with
Mm-hmm.
fertility struggles.
Mm-hmm.
What are you seeing there?
Yeah. There's totally a connection. especially with Hashimoto's and PCOS, Hashimoto's and infertility, more so because we need thyroid hormone it's basically like our master gland of all of our endocrine system, right? So if our thyroid is under functioning, all of our other hormones are going to follow suit downstream, and it sets the metabolism as well too. So if your body, every cell in our body has receptors for thyroid hormone. So if you do not have enough thyroid hormone, it's going to slow down everything, slow down metabolism, slow down reproduction, you name it. And so, but it's the same thing with like any poorly managed autoimmune condition. If you have poorly managed RA, or if you have poorly managed lupus, or whatever it may be, diabetes, type 1 diabetes, Hashimoto, celiac, it's going to be inflammatory in the body, and that inflammation is going to make it more difficult to conceive. So the kind of central tenet of all of these is inflammation and autoimmunity and underlying immune dysfunction. So if you can address that through diet and lifestyle and get the immune dysfunction under control, support the body where it needs as far as micronutrients go, then you're going to be in a way, way better place. And then also figuring out what your triggers are specifically. So I tell my patients across the board with Hashimoto's and celiac or type 1, gluten should just not even be in your diet. There's literally not a single reason why you should be eating gluten. It's super inflammatory for those with any sort of autoimmunity. And so I'm a super big proponent of a gluten-free or grain-free diet for people with autoimmune conditions like Hashimoto's. And that alone, just really cleaning up the diet and removing the gluten and the grains, can be really, really effective. So I know there's a lot of people in the functional medicine space, PCOS space, all the things, who are like, we can't cut out food groups and all the things. Well, gluten is a protein found in wheat. It's not a food group. You can still eat bread if you want to. That's cool, whatever. It just needs to be gluten-free. But there's really not a ton of nutritional value to bread either. There's no real reason we need it, right? And so that's a big one, is just figuring out what the triggers are. But most people I've seen with autoimmunity, hypothyroidism, Hashimoto's, PCOS, they don't do super well with gluten across the board. It's just those things where I haven't seen it be productive for really anybody. And so that's a really big one.
Yeah, my naturopath was telling me years ago, which I actually did a hard stop on gluten after the
Yeah.
holidays last year.
Okay.
And I felt so much better since I cut it out. But
Mm-hmm.
she was telling me there was actually a study of
Mm-hmm.
taking women off of gluten and them
Mm-hmm.
actually getting pregnant more easily. I wish I
Mm-hmm.
could cite the study. I will ask her, and if I can find it,
Okay.
I'll put it in the show notes for this too and send it to you. But
Yeah.
apparently there have been studies done on the connection between gluten and progesterone as well.
Interesting. I mean, I've seen that anecdotally, but I didn't know there was a study on it. I need to find that too. I'm really curious to read that, because I've talked about that in my programs, in my PCOS program, which is pre-ChatGPT era. I created it 5 years ago. I've talked about that for years. That I think there's a huge connection between the gluten inflammation cascade and getting your hormones under control and getting pregnant. Which, it's weird. Everything really comes back down to inflammation. Like, I've talked about that a lot on this podcast. But it's true. If gluten is creating inflammation in the body, your hormones are going to be suppressed. Ovulation is going to be suppressed. If ovulation is going to be suppressed, progesterone will be. The only way we make progesterone in the cycle is after ovulation, right? So a lot of people come in and they'll say, "Oh, my doctor told me I have low progesterone, so they gave me a progesterone cream." Okay, well, why are you not ovulating? First of all, why are you not making your own progesterone? That's what they need to be asking you, not masking that issue with a progesterone cream, right? Most women who are having healthy ovulatory cycles make great amounts of progesterone, unless they're deficient in certain micronutrients like vitamin C and things like that. Once we work on that, you don't have a progesterone issue, and you don't need that anymore. So like in your case, you were describing how your progesterone was like 0.2. That tells me that you just were not ovulating at that point in your life.
Wow.
Very likely. If your progesterone is that low, that is a sign of an anovulatory cycle, meaning you did not ovulate, or it was tested at the wrong time. Like if you went in on day 12 to get your blood labs done, I would expect progesterone to be low. I only expect progesterone to be high in the luteal phase after you've ovulated,
Yeah,
right?
this was day 21. I always test on day
Okay.
21.
Yeah. So my caveat is always, when I talk to my patients, I say, make sure you get your hormones done on day 21 of your cycle or 6 days after ovulation. Because someone like me, I ovulate on like day 18 or 19 every month pretty consistently. And so my 6 days after ovulation will be much later than day 21. So that's why I'm just a huge proponent of tracking your cycle and with a temp drop or a needle, whatever it might be for you, whatever method you prefer, whatever's easiest for you, and then going on the correct day of your cycle, which for you is probably day 21. But even then, yeah, that's really interesting because Yeah, people just overlook that. Like, where does progesterone come from? Where in physiology is that happening? Oh, it's ovulation. We can only make progesterone after ovulation. So,
Yeah, for sure. And this is really important. I mean, I've become a progesterone addict lately, just like learning about it. But is there ever a case like early in pregnancy where you would prescribe some bioidentical progesterone?
100%. Yep, this is my one exception. Not one, I should say. This is one of my exceptions. I am a huge advocate for bioidentical compounded progesterone in the first trimester. It will save lives 100%. I will die on that hill unless someone proves me otherwise. Come prove me wrong, right? But I'm a huge advocate, which is so weird because OBGYNs are not giving their patients progesterone, and my patients are having to fight to get it, which
Wow.
is crazy because I'm like, you are so quick to put someone on synthetic birth control or synthetic hormones, no problem. But when they're now pregnant, you don't want to give them their progestation hormone. That's what progesterone is. It sustains and helps maintain pregnancy. And we don't start making our own progesterone until well into the second trimester. And so, or I should say, the placenta doesn't kick in and make progesterone until the second trimester. So, low amounts of progesterone are made in the first trimester. And if a woman isn't making sufficient amounts, that can lead to early miscarriages and losses and things like that. So, that's what I'm seeing a lot of. And I've seen that be the sole reason why someone can't maintain a pregnancy. Not always. I think progesterone is sometimes unfairly blamed. But some cases are true progesterone deficiency, which makes me so sad because I think a lot of these early miscarriages can be easily prevented.
Mm,
So for me, in my case, just with what I know now, if I were to get pregnant in the future, I would just proactively start on progesterone. Now I make good amounts of progesterone on my own anyways, but there's no harm to it. And so that's kind of my point of view on it is in the first trimester, it's sustaining life and life is going to be more important than the alternative, which is not taking progesterone.
yeah, especially if it's natural bioidentical. So speaking of progesterone killers, because this is a
Yeah.
really important topic,
Yeah.
what about polyester? Are the
Oh
clothes
God.
that people wearing
Yeah.
contributing to their inability to get and stay pregnant?
Gosh, I certainly think so. I've gone down the fabric rabbit hole a lot in the last couple of years,
Same
and
girl.
they've done studies on female dogs, and we've seen that contributes to infertility in animals. And obviously, I hope they're going to do a human study on this soon, somehow in a safe way. I don't know how they would do it. Potentially, maybe just having a woman wear polyester for a period of time and then switch to organic cotton or something like that in her clothing. I think it makes a huge difference. What I have seen anecdotally, which I always come back to, is women with chronic BV and yeast infections. When I just switch them out of their polyester underwear into organic cotton underwear, their BV and yeast infections start to go away.
Wow.
Um, yes, I have a friend that has recently overcome cervical cancer, thank God. And she told me, she's like, I think this is connected to all of the Lulu leggings I wore for years and years and years. It's just intuitively kind of that's what she was thinking. Because it's so close to our intimate areas, and the cervix is not far from where our leggings are. Our lymph nodes are so close to that region. Our bloodstream, we absorb everything through our skin. It's our largest organ. And so I absolutely think these microplastics, which if you look up like nylon and polyester and fabrics like that, are literally made of microplastics. So I absolutely think they're not only contributing to obesity, cellulite, endocrine disruption, but likely also fertility too. And I hope that we have more in-depth studies that come out about that soon. But I think there's no harm in switching out your fabrics to organic cotton fabrics, linen fabrics, fabrics that are more natural and sustainable. Do you follow my friend Abby Fernandini? She owns Be Well Fitted. You would
Um,
love her.
the name Be Well Fitted sounds so
Okay.
familiar, so it's very
Okay.
likely that I do.
Yeah, they have the hat that says farms over
Yes.
pharma.
Oh my gosh, I
Okay.
love that hat. Yes.
Yeah, so they're all about like sustainable organic clothing and things like that too. I love their stuff. I love, companies like Pact and
Hmm.
Mate and some other ones that have good organic fabrics. But
Oh yeah.
absolutely, I definitely think that these microplastics, they're finding microplastics, by the way, in sperm cells. They're finding them in ovarian tissue. They're finding microplastics in placentas.
And
So
everything.
everything. So for instance, for me, I haven't drank out of water bottles, plastic water bottles in a decade or more. I don't even know. Maybe like once in a blue moon on an airplane, I'll have a water bottle. But Otherwise, I have no exposure of microplastics in my entire environment. And I did a total tox burden on myself, a lab test, and my BPA levels and the other markers for plastics were really high. And I was like, this is insane. The only way it could be coming into my bloodstream is through clothes that I've been wearing, because these are forever chemicals. It's very hard to detox it out of your body. So I think it's kind of a good thing that I'm seeing it high in the test, because my body is excreting it in the urine. So I'm kind of okay with that. My body's at least detoxing it somewhat, but it still shows that I'm detoxing a lot of microplastics. So why are they still in my bloodstream? Why are they still in my system? Why am I still eliminating it from the urine? That to me is a big question mark. I'm like, why is this happening? So I think we're getting exposed to more microplastics than we even realize in our environment. And a big source is through our clothing, 100%, especially if you're sweating in that clothing.
That's the thing too. I mean, sweat is a major
Mm-hmm.
detox pathway.
Mm-hmm.
So I'm like, and with
Yeah.
these fabrics, like, okay, yeah, I started doing non-toxic activewear. And when I wear a
Yeah.
light color, I'm wearing Mate
Mm-hmm.
the Label right now, and
Yep.
it's like a tan color, right? And
Yep.
yeah, I'm gonna show some butt sweat,
Mm-hmm.
when I'm
Yeah.
working out.
Yep.
But I caveat, as much
Mm-hmm.
as that might be unattractive to
Mm-hmm.
purchase something you're gonna see sweat through,
Mm-hmm.
if that sweat is wicking, I'm like, okay,
Mm-hmm.
sweat wicking clothing, it's just recirculating. You're
Yep.
detoxing the toxins, and
Yep.
then it's mixing with those microplastics and
Mm-hmm.
petrochemicals and then going back into your bloodstream. I'm like,
100%.
it's absolutely wild. And then sitting in the sauna in these clothes, you know what
Yeah.
I'm saying? Like after a
Oh,
workout, it's
oh my
crazy.
gosh. No, 100%. I mean, gosh, I can't even think about how many times that I have worked out in polyester clothing before I knew what I know. It's just, it's crazy. It's
It's
so crazy.
crazy.
And then if you think about where our leggings are, that's also where most women hold excess fat and cellulite,
True.
and they can't get rid of it. I've done a really big deep dive into lipedema in the last couple years, because I'm seeing it's more and more prevalent. And it's almost always in the lower half, but that's almost always where we wear the most amount of microplastics. And so
Mm.
it's like, why are we developing these like fibrous cystic uh, diseased fat cells? Like, why is that happening, and why is it more prevalent now than ever? And so that's a big question I've had. I've thought about a lot in the last couple of years. Is just the insane amount of endocrine disrupting chemicals that we are exposed to, that we are wearing, that we are breathing in, and how our bodies are responding to it is so sad to me. But I'm seeing it. I'm seeing it a lot.
Yeah, I think that polyester clothing, but specifically like underwear and activewear,
Hmm.
eventually, hopefully soon, are going to be the new antiperspirant deodorant where we realize like,
Yes.
we actually need to sweat, and then
Yes.
realizing how important that is to breathe. Honestly, I think it comes down to we need to normalize sweat. We need to make sweat
Yeah.
sexy again, and just
Yes.
realize it's not gross. It's a body process. And also, if you have
Right.
excessive body odor, that's
Yes.
not normal either. That's dysbiosis. So
Yes.
if you're so gross and sweaty that you can't wear cotton or you have to wear
Hmm.
antiperspirant, it's probably something else going on that needs to be addressed,
Yeah. Oh,
right?
yeah. Stinky feet and BO are signs of a really toxic system, and nutrient deficiencies, magnesium deficiencies. Um, Absolutely. It's just a sign of a heavy toxic load. And so I encourage people, if you do have bad BO, skip deodorant for like 2 weeks, let your body start to drain and detox it, get in a sauna, do some like create like a at home charcoal mask, put it on your armpits, pull those toxins out. But it's crazy. All the metals in antiperspirant deodorants that we put on, they literally clog our sweat glands. And then people lather on body lotions with fragrance in them. And I'm like, oh my gosh. So where your body needs to actually detox, you are now clogging it with fragrances and chemicals. And it's so hard to watch at this point.
It's absolutely absurd. Okay, totally switching gears because
Yeah.
I find this very fascinating. So, with prenatal vitamins,
Mm-hmm.
you hear a lot about the importance of getting that,
Mm-hmm.
just a lot of those nutrients in the first 5 weeks, obviously for
Mm-hmm.
neural tube development.
Mm-hmm.
Okay, folic acid versus methylfolate. What's the
Yeah.
difference, and why would you choose one over the other?
Yeah. So folic acid is not naturally occurring in the body at all. It's folate. Folate is what we get from food sources. Folate is what we get from the environment. Folic acid was a lab created nutrient that half the population cannot even convert to its most available form and utilize. So folate is already in its methylated form. It's already ready to be utilized and used in the body. It's already pre-converted. And folic acid for a lot of people, especially with MTHFR, is highly inflammatory. So for me, if I were to take folic acid, I immediately get this like metallic taste in my mouth. I start to get a headache. My body cannot use it. Also, you might notice that your pee is like neon green when you take a lot of these really lab created synthetic vitamins like folic acid or cyanocobalamin. They're just not natural. They're not in their most natural form. And so that is one of those things where I'm like, it can't be debated. Folic acid is not found in nature. Why are we encouraging women to take this? It's same thing with synthetic versus bioidentical hormones. I'm like, I want to take a hormone in its most bioidentical form, in its most natural form, how it's naturally occurring. Why would I take a synthetic estrogen when I can take a bioidentical estrogen? Right. And so it's like we've gotten halfway there because half of the medical system at least understands that. Some of them still don't. Some of them think synthetic birth control is the same thing as bioidentical hormones.
Wild.
Yes. Like
What?
I've seen women in menopause be prescribed birth control as HRT. And I'm like, that is literally not the same thing. It's
No.
not the same thing at all. And so anyways, I hope at some point people can get on the same wavelength. There are studies out there showing that miscarriages and pregnancy outcomes are significantly higher when women consume folic acid versus methylfolate.
Wow.
I should say negative pregnancy outcomes and miscarriages are significantly higher, especially in the MTHFR population. That's the main one we're looking at, especially with this stuff. But literally, there's no benefit to taking folic acid. So why would you just not take a methylated folate option when you have that option? So that's unfortunately like every prenatal on the market. I feel like that women have quick, easy access to at like a big box store has folic acid.
All the gummies and
All the
like,
gummies. Yep.
yep.
In my opinion, I'd rather someone not take a prenatal at all versus take something with folic acid. That's my opinion.
Wow. Okay. And then, so if somebody's taking, let's say, a good prenatal that has the
Mm-hmm.
methylfolate,
Mm-hmm.
all of the right stuff, how early do you recommend they start taking a prenatal
Mm-hmm.
if they are on like,
Yeah.
if they're thinking about trying to conceive? Like, when should they start taking it?
Honestly, as soon as possible. So as soon as you might even have the inkling that you want to have kids in the future, that's when I think you should start taking a prenatal, because those micronutrient deficiencies, nutrient deficiencies across the board can take a while to get out of the deficiency state and get out of the suboptimal state into the optimal state. So at minimum 6 months, in my opinion, before conception, ideally 12 months before conception, but even longer. And then my suggestion is that women take their prenatal up to 18 months postpartum, if not a little bit longer. But that's basically how long it takes to kind of get repleted after birth. And in postpartum is such an energy demanding state, like pregnancy is such an energy expensive state. And so you really need to restore a lot of those vitamin stores in postpartum. And then especially if you're breastfeeding, you're using so many nutrients to create breast milk. So that and omegas are two things that I think are so crucial in postpartum, but also in preconception as well too. And most prenatals on the market are significantly underdosed in a lot of critical nutrients. Like everyone talks about folate, but no one is talking about choline, which plays an equally important role in neural tube defects and brain development in infants and things like that too. So that's why, if you're okay with me kind of talking about it,
Please
that's
do.
that's why 5 years ago, a little over 5 years ago, I formulated my own prenatal because I saw these issues. There was no prenatals on the market that were fitting the needs for my patients. I was having to put them on like a $60 choline supplement and then a $50 prenatal and then a $60 omega and then magnesium and all this stuff. And I'm like, okay, this person now has just spent $250 on a
Every month
prenatal
too, right?
every month that should be in one product. So like our prenatal has a significant clinical dose of magnesium, more than you're going to find in most just individual magnesium bottles. 350 milligram dose, 900 milligram dose of choline, which is double the highest dose of choline on the market in any other prenatal. So like the Needed brand and WeNatal, they have about half the amount of choline that our prenatal has. It has more folate than any other prenatal on the market. And so these are things that I was really just not happy with, even in the practitioner grade supplement world, like the Metagenics brand, all of the other ones. I was like, this is fine. I'm not worried about my patient taking like a dangerous product, but it's not enough. And so that's really why I kind of formulated my own, just selfishly for my own patients. I'm like, I want you guys to have a better product and I want to have better outcomes. I want to see women have better pregnancies. And so I'm going to put exactly what I want in this prenatal in the product for you guys. And it really turned into be something I didn't even expect. But I'm very, very passionate about the prenatal space because most women are just not getting what they need at all.
I love this. What is your prenatal called? Because I bet you so many
Mhm.
people listening are going to want to go check it out.
Yeah, so we just rebranded, and the new name is going to be called Fig. Fig Wellness is what the company is called. You can find us
Love
at
it.
Fig Wellness Co. I kind of chose it because figs are a biblical fruit, and I wanted there to be biblical ties and biblical significance to our brand name. And so the Bible talks a lot about fig trees and figs and things like that. And so I wanted it to be a biblical food. Or biblical fruit. And if you think about fertility, fertility is being fruitful, right? Right. So I wanted it to be a fruit. I wanted it to be about being fruitful, because that's what the majority of our customers are coming in for. They want to be fruitful. They want to multiply. That's the Bible talks about. And so that's really important for me. And so, yeah, that's kind of how we came up with the name of our company. We have a men's product as well. So it's a men's multi with fertility support. So we have herbs in there that actually support testosterone production. We have nutrients in there that support sperm production. And so men are half of the equation. So we want to support men just as much as we do women. So we have a his and hers bundle for that. And so that's something I'm really, really passionate about. The more and more I work with, or we in general in our practice work with men, I realize there's really not a huge, there's not a huge market right now out there for men's products, or there's not a lot on the market, I should say, for men's products. And there's a huge gap that needed to be filled. And that's what I saw in the prenatal space about 5 years ago too. So I'm really excited about that. And I think that it's going to really change a lot of lives.
Congratulations. I love
Thank
this because
you.
it is so true that, I mean, women, it makes sense. Women consume way more than men when it comes
Mm-hmm.
to like being
Mm-hmm.
proactive, shopping online for something, right? But they're half of the equation, they're half of the
Yeah.
baby, and they contribute so much. So I love to see that you guys are also bringing more education and light and resources to the men because
Yeah.
how many women take the blame when they have a miscarriage or when they can't get pregnant and it attacks their womanhood and it might not even
Mm-hmm.
be them or it might not solely be them.
100%. A lot of early miscarriages are tied to the men.
Wow.
And men still, the more data we put out about this, are still so in denial about this. I mean, some of the videos I've posted that have the most views are about men's health, and the men in the comments are like, well, why don't you talk to the women about this? And it's like, what?
We've been
You
talking to the women.
Yeah, we've been talking to the women. Women for the last 50 years have been taking prenatals and are aware of all this stuff. And just now in 2025 are we bringing men into the conversation, which is mind blowing to me. I'm like,
Yeah.
why is this now a more mainstream thing? Like this is common sense. The DNA is literally half the man and half the woman. So the fact that some men still are not on the same page with that, I'm like, okay, you guys need to step up. And in my husband's words, like he's like, men are the providers and the protectors. And so why are you not also providing and protecting your future children's health? And why are you not putting yourself in that position to be the protector of your family by being healthy and by giving your body what it needs? So when he talks to men, he kind of talks to them about that quite a bit too. Oh my gosh, he has a little slogan and I can't remember. There's like 3 P's: provide, protect, and there's one more. I can't even remember. But he
I
talks
love
about
this.
men's fertility a lot with that. So anyways, yeah, it's a really big piece of the puzzle.
I love that. I actually recently did some content talking about like being an Ephesians 5 husband, loving your
Yeah.
wife. Yeah, it's
Yes.
like loving your wife is also ensuring that she has a healthy pregnancy as
Hmm.
far as what you can do, right? What you can do for
Oh
your
yeah.
health, ensuring, doing whatever you can to protect your family and to make
Yes.
sure that her health is good when
Hmm.
she's carrying your seed. Like it's so important. So for you,
Yeah.
I think it's really interesting that you have the perspective as a doctor and the perspective as a
Hmm.
Christian, which is something
Yes.
that I really like about you.
Oh,
And
thank
I'm
you.
really curious. Yeah, of course. I'm really curious. And it can be whatever. And also, if you don't want to answer this question,
Hmm.
that's okay. Because I know it can be hard to stay sensitive with this topic. But
Yeah.
what is your perspective then on IVF?
Oh yeah, that's a tough one. I have a lot of like moral challenges with it.
Same.
Yeah, I have a lot of moral challenges with it. I think that especially when you get into like embryology and them trying to find like the best egg and the best sperm and all this stuff, I think it kind of gets in the territory of playing God a little too much. It makes me uncomfortable. My husband and I have talked about this extensively. Like, if we were to ever need it, I don't think I would go that route. I think I would adopt or foster before doing that. Now, I know some women and some couples really, really want their own biological child, and I respect that 100%. But I think in general, and I don't want to say it's morally wrong for people to do IVF, right? For me personally, I don't think I would do it. Um, it's unsettling to me when couples have all these stored embryos. What's happening to those unused embryos? That's a big question mark I have. Now a lot of couples go in and they're like, we fully plan on using all of our embryos. And like, I know several people who've done that, and I love that. Like that's great. But the people who are going in and having endless amounts of egg retrievals and creating endless amounts of embryos, kind of just to like stock them up and store them, that to me, personally is unsettling, because I just want to know, like, where are they going to go? Like who's making the decision on which one's best? And it's just, I've seen multiple cases of this too, where people go through IVF, they've chosen the healthiest embryo, they've done all these things, and then their baby is born with deformities or congenital abnormalities and things like that. And the people are now angry because they're like, well, we paid for this and we got the best embryo, and now our baby has issues. I'm mad about it. Like, I've seen people complain about the health of their child when they've gone through IVF, because they now have this thing in their mind that IVF is equating a perfect, healthy baby, which we actually know IVF babies have more health challenges than naturally conceived babies. The IVF process creates, there's more synthetic hormones involved. It's not as natural. You're kind of forcing the body to do things it's not ready to do. So many things there. But there's a lot of people who think that because they're now paying so much money that they're going to get a better quality product. And it's just a weird concept for me, all around. But I think the biggest thing with IVF that I'm not comfortable with is the predatory nature of the industry. It's not even the people, like most people that are going through IVF, they just want a family so bad that they're like, well, this is where my OB told me to go. Like, this is all I know. And they haven't done the deep dives that we've done and things like that. They genuinely don't know. And so I think for me, it's the really predatory industry of IVF and how they really go in and they give couples no other options. And so couples kind of go in defeated, they go in upset, they go in sad, they go in desperate. They want a baby so bad. They're going to do anything. And then you have this doctor in a white coat looking at you like, well, this is your only option. And we're going to start egg retrievals next week. And we're going to rush everything. And we're going to do this and this and this. And they overwhelm you. And these people leave. And I just talked about this with someone else too. It's just like the cancer industry. They're so pushy. It's so rushed. They give you no choices, no options. This is our protocol. This is what you do. Everybody goes and gets the same exact plan and protocol. There's no bioindividuality mixed in. And so for me, it's like, that's where I start to have issues, when every single patient is treated the same. Every single patient is put on the same protocol. They synthetically shut down your own cycle and give you synthetic hormones to mimic your cycle. I just talked to someone yesterday who said, I did IVF and they gave me a medication that suppressed all of my hormones so that they could give me hormones. So they put her into a temporary state of menopause and then started pumping her full of synthetic hormones because they wanted to control her cycle. I'm like, that is not natural. And as a believer, as a Christian, to me, it's unbiblical in a sense of, you're forcing the body to do something that it's not ready to do. Like, God did not design us that way. Like, God designed us to be fruitful and to multiply and to be able to, and to love our bodies and to be able to support pregnancy naturally. I feel like it's not natural.
Yeah, for sure. Yeah, and it's such a touchy subject because I'm like, I don't think the blame is with the moms who just want to get
No.
pregnant. It's definitely with the systems that prey
Mm-hmm.
on women who want to get pregnant and on
Yeah.
men, and just do make them feel like this is the way forward. I think it's really interesting, and I don't
Mm-hmm.
know exactly how the storage works, but as
Mm-hmm.
far as I know, for some people, let's say they're paying rent, if you will, right, on their
Yeah.
embryos. So what if I were to pass away? Now, is the next generation, like, are my children and grandchildren now going to hold the moral responsibility to choose whether to pay to keep
Mm-hmm.
my embryos alive
Right.
or to terminate?
Right.
Like, that's kind of a big moral responsibility
Right.
to put on other people, and that's what I've always
Right.
thought. I mean, I
Yeah.
don't want to make somebody that I love choose
Mm-hmm.
something immoral because they can't do it, right?
Right.
And then the other component, of course, is if you have like multiple implantations,
Mm-hmm.
the amount of abortion. And
Mm-hmm.
I personally speaking, I'm extremely pro-life, and
Yeah. Same.
yeah, and I know my audience is a mixed bag, but for me, I obviously, some people, I know my parents considered IVF. Actually, the first round
Mm-hmm.
of pregnancy, they struggled with my older siblings and they considered IVF. They didn't end up
Mm-hmm.
doing it, but they had a conversation with the fertility specialist and they were talking about that component. And my parents were like,
Mm-hmm.
my mom was like, I don't care if I get pregnant with 5 babies, I'm having all 5. Like,
Right. And
I'm not,
yeah.
yeah.
That's what a lot of my friends have said too, that have gone down that road. They're like, we're going to implant every embryo that we get. That's their plan. Right. And I think there's so many things to think about here too, because I always say, because I want to like speak to the person who probably is angry at us right now, maybe
Yeah.
listening.
Oh, they're
And
probably there.
yeah, and if you're thinking like, how dare you? You've never walked a day in my shoes. Like, we want a baby so bad. This is our only option. That is something that you've been conditioned to believe. That's what I want you to hear. That's something you've been conditioned to believe by a system who profits off of your infertility.
Mm.
How about we pivot that mindset of how can I support my body and what is my body lacking and why am I not able to get pregnant naturally? Like, why is this actually happening? Because once you start to do that, and a lot of my patients have come in after doing multiple rounds of IVF unsuccessfully, and they're like, basically, I'm their last resort. And they're like, if this doesn't work, we're just giving up. And I'm like, okay, first of all, don't give up. Second of all of those patients have gotten pregnant. Like, there hasn't been one where they came in, they were distraught, they couldn't figure out how to get pregnant, and I was like, I just don't know. There's been one, she's actually pregnant now. She's pregnant now, so she was like my one, but no, there hasn't been anywhere I'm like, I just don't know why IVF didn't work. No, I've always been able to identify a very very obvious reason. In my opinion, they just never looked into it. And so, like, don't give up on that. Work with a functional provider who specializes in fertility specifically, not just any functional medicine provider, someone who specializes in this. Have them help you, because you're going to end up spending 5 times more to go the IVF route, get no answers, and potentially end up without a baby. And that's the other thing that I really despise about the IVF industry is they basically make it seem like it's a sure deal, like it's a done deal if you go that route. And couples go in with this false sense of security, like, oh, well, if we can get pregnant, we'll just do IVF. But it's still not guaranteed. Yes, it does work for some couples, but the outcomes are still only around 25%.
Wow.
So it's very low. Yeah, the outcomes are not super great. A lot of these clinics are also manipulating the numbers, manipulating the outcomes, to make them sound like they're having better success rates. So there's a lot of issues I take up with the whole industry. It's like, now there are a lot of good ones. I love NAPRO doctors. Let me say that. I love NAPRO surgeons. I love that NAPRO technology. They're taking a more holistic approach to fertility. They're getting people pregnant naturally. They're not using IVF for the most part. A lot of times it's things like endometriosis. A silent endometriosis diagnosis can be the reason why someone's not getting pregnant. So you can do all these rounds of IVF, or you can just address the endometriosis and then you can get pregnant naturally. So that's why I really like NAPRO surgeons, because they're kind of like a counterpart to me that's looking at the internal structural side of infertility. So I refer a lot of my patients out to a NAPRO doctor in their area, and I'll say, let's just rule out these structural reasons, these structural causes first, right? I want to do my due diligence and make sure that we are looking at all the things that could be happening. And so that's really, really helpful too, is being aware that there are good people out there. There are good doctors out there, but a lot of these fertility clinics are kind of just like mills, and they just run a lot of people through it, and they're for profit, and it's not great.
Yeah, it's pretty crazy the more you dig into it. Like
Mm-hmm.
I'm learning just now how predatory it is in the last few months, and
Mm-hmm.
it's pretty shocking and pretty sad
Yeah.
because it preys off of the most biological need a woman could ever have.
Yep.
Like, it's a
100%.
when a woman decides she wants a baby and she can't have
Mm-hmm.
it, it's
Mm-hmm.
extremely painful. And
Oh
I really
yeah.
I believe it hacks so many women's confidence in themselves as a woman, and to prey off
Yeah.
of that feels dirty
Yeah.
versus doing something that's going to be not only helping them in this round, but probably helping them A, have a better pregnancy and
Mm-hmm.
postpartum, and B, get pregnant again, like, in the
100%.
future, because they're actually healing those root causes instead of having to go back to these systems over and over and spend tens or hundreds of thousands of dollars in the end of it.
Yeah. And what people are doing inherently too is they're like rushing biology. They're
Mhm.
rushing their own biochemistry. And you just can't do that. You can't rush the body into doing a normal biological process. You have to be patient with it. And the people that I do see going down that route are people who are like, well, my clock is ticking, like I'm almost 35 or whatever it may be. And they have this like this this timeline that they're going based off of. And sometimes you just have to don't stop searching for a reason. That's what I will say. A lot of people, I think, are just like, it'll happen when it happens. And I'm like, it will, of course, 100%. I believe that. But also, we are given the brain and the tools to figure out why things are not happening. Like, I firmly believe that God has given me the ability that I have to help people so that they can get pregnant naturally. I believe he's giving me the brain and the common sense and the wisdom, right? I don't think that I'm bypassing him by any chance. I think I'm using the gifts he's given me. And the second I feel like I'm going beyond that, I check myself, because I'm like, no, I'm not doing any of this. Like, I'm not doing any of this. I've been given all the tools I need. A lot of what I do with my patients is strictly based on like discernment and wisdom. There's a lot of times where a patient's just talking to me and I like get this innate sense. I'm like, it's infection or it's whatever. Just, it's like a gut feeling. And so that's Holy Spirit, obviously. But yeah, I feel like that that is like really important to understand too, is you can't rush it. There are reasons for everything, but also like utilize the tools and the wisdom that people are given to figure things out, and don't just rush to, IVF or fertility treatments right off the bat.
I love this. I love your approach. So for, before we end the episode, I'd love to know
Mm-hmm.
if you could give one piece of just a
Mm-hmm.
word of encouragement to the couples right now who are
Yeah.
currently struggling to conceive or maybe have
Yeah.
given up already. What would that
Mm-hmm.
be?
I think for me, it would be make sure that you are first and foremost focusing on your marriage, because this is an extremely taxing process on a relationship. I've seen a lot of couples split up over it. I think the biggest thing is making sure that you're doing it with the right intentions and you're not doing it because of external pressures, and really get back to your why, right? So that's really, really important for me is when I see a couple, make sure you guys are on the same page, make sure you're praying together, make sure you're talking together, make sure you're on the same page, and make sure your why is there. And then, the next thing is just don't give up hope, because it's absolutely going to happen for you. It's just a matter of when. And you really, that is where the faith component comes in, because you literally have to give it up to God and be like, I know it's going to happen for me. I just need to have faith in the process, and I'm not going to try to rush it. The same way, like if you're a single woman and you're waiting to find your husband, it's like, I thought when I was 25 or 24, when I had not been married yet, that I was so old and all these things. And then I met my husband just a short time after, and I'm like, okay, like the world is not over. God had a plan for me. He had a plan for this. Yes, I wish I would have met my husband when I was 20 and avoided all these terrible boyfriends in between, but I didn't. And that was part of his plan. And that's okay too. So it's kind of like you're a friend of mine. Her name's Angie. She kind of describes it like you're in the waiting room. And that's kind of what fertility feels like, or infertility feels like, is that you're in this waiting room and you don't really know when your name's going to be called. But that is where I believe faith comes in and prayer comes in, and just being super prayerful and understanding that it will be your time soon, and just kind of be faithful through the process.
Beautiful. I love those words of encouragement. I think that's a message for a lot of people, especially
Mm-hmm.
women, that they really need to hear today.
Mm-hmm.
What is your health goal right now?
Yeah. So I'm actually in my preconception era too, which is really fun.
Wow.
Yeah. My husband and I both have, gosh, I had the longest run of health stuff. We were both super sick with mold illness and all the things for years and years. And so we've both been like chipping away at little things along the way. Our biggest thing too is we want to make sure that we are in a really good place financially, business wise, and our marriage. That is just a really big, important goal to us. And so that might be different for other people, but I always say we're in the practicing phase now. Um, it's just been, our lives have been a little crazy up until recently, and we were building a business and getting through grad school. And so we just didn't want to bring children into the mix until we were super, super steady. And so we finally feel like we're in that place. So I'm in preconception. And so that's my goal, is to just do everything we talked about on this podcast and practice it all with you.
Oh, that's so fun. Well,
Mm-hmm.
congratulations. What a fun
Yeah.
journey. Really
Yeah.
exciting time. Well,
I know.
where can people find you if they want to find you on social media
Mhm.
or if they want to work with you?
Yeah, absolutely. So you can find me on Instagram at Dr. Natalie Underberg. Our private practice is called Roland Functional Medicine, but you can also just Google me and find our practice that way, or reach out to me on Instagram. And if you want to work with us, I do discovery calls where we can just hop on a call. You can tell me your story and see if it's a good fit. We are virtual, so we can kind of work with people wherever they're at, which is awesome.
Mhm.
And so, yeah, if you feel like your heart is being pulled to just have a conversation with me, I would love to chat with you and see how I can help you, and just, don't be discouraged.
Amazing. Well, you
Hmm.
guys, I hope you love this episode. I know I did, and I learned so much. To those of you who are struggling right now or even considering getting pregnant and maybe there's some fear around it, I hope and pray that this has been such an encouragement to you, that it'll come, and it just takes some holistic root cause, getting to the bottom of things. But there are people like Dr. Natalie who are going to be an amazing asset on your team when it comes to getting pregnant and staying pregnant. Dr. Natalie, thank you so much for joining today.
Thank you so much. We'll talk soon.
Talk soon.